Hello, my name is Kazumasa Nagai. I'm a gastroenterologist at Tokyo Medical University in Japan. A paper from our institute entitled Long-Term Outcomes After EUS-guided antegrade intervention for benign bilioenteric anastomotic stricture is published in the Gastrointestinal Endoscopy Journal. We are grateful for this, and it is a great honor to be able to share our findings with you. So, why we conducted this study? Bilioenteric anastomotic stricture is a significant adverse event after hepatocetostomy. Conventionally, bilioenteroscopy assisted ELCP, what is called BELCP, was attempted for such patients. However, BELCP is not always successful because of technical difficulty and time constraints. Recently, EUS-guided antegrade interventions, so-called EUS-AI, has been developed in cases of BERCP failure. Several reports have demonstrated the efficacy and safety of EUS-AI. However, the results of these studies were limited to short-term outcomes, and no studies have reported long-term outcomes after EUS-AI. Specifically, the rate of structural resolution after EUS-AI and the rate of subsequent recurrence have not been clarified. Furthermore, some cases show recurrent cholangitis, even after successful biliary drainage. Practically, refractory cholangitis after anastomotic stricture can lead to secondary biliary cirrhosis or hepatic failure in the long term. So we conducted a single-center retrospective study to identify the long-term outcomes of EUS-AI for bilioenteric anastomotic stricture in patients with surgically altered anatomy.
About our study, between November 2013 and November 2021, 52 patients in whom BERCP failed and who attempted EUS-guided biliary drainage for the treatment of bilioenteric anastomotic stricture at our institution were retrospectively identified. In this population, 34 consecutive patients who achieved EUS-guided biliary drainage and who were followed for more than 1 year were included in this study. The median follow-up period of the 34 patients was 56.7 months.
The primary endpoint was the structural resolution rate. We also identified the factors associated with structural resolution, the rate of structural recurrence, and the rate of hepatic fibrosis progression during follow-up. Hepatic fibrosis progression was assessed by the FIB-4 grade in this study.
31 of 34 patients successfully underwent antegrade treatment for anastomotic stricture. And finally, structural resolution was achieved in 17 cases. So the structural resolution rate was 50%. And 6 of 18 patients showed recurrence of anastomotic stricture after stent removal. So the rate of structural recurrence was 33%.
During the median follow-up period of 56.7 months, 25% of patients progressed to hepatic fibrosis based on the FIB-4 grade. We then analyzed the risk factors for fibrosis progression.
In the Cox proportional hazards model, cases of severe stricture and failure of endoscopic antegrade treatment through the anastomotic side were significant risk factors for progression of hepatic fibrosis in the univariate analysis. In addition, the progression of hepatic fibrosis was observed in all patients with cholangitis during follow-up. The strong points of our study. 1. This is the first study to show the long-term outcome of EUS-AI for bilioenteric anastomotic stricture. 2. We clarify the factors associated with structural resolution after EUS-AI in the long-term course. 3. This is the first study to clarify the frequency of hepatic fibrosis progression during the long-term course. and to identify the risk factors of the development of fibrosis.
How do we develop this study in the future? First, this is a retrospective single-center study, so the possibility of potential selection bias cannot be ruled out. A large number of cases would be required, and we would have to conduct a prospective study. Second, the progression of hepatic fibrosis was evaluated using the FIB-4 grade, which is a non-invasive fibrosis marker, but it would be controversial to use the FIB-4 grade to assess hepatic fibrosis with a background of anastomotic stricture. To verify its validity, we evaluated the progression of fibrosis using imaging data. The kappa value was 0.79, which is substantially high and supports the validity of this assessment. However, for an accurate assessment of hepatic fibrosis, future prospective study using modalities such as MRI elastography should be conducted. In conclusion, EUS-AI has achieved acceptable long-term clinical outcomes after EUS-AI or bilioenteric anastomotic stricture. The patients for whom BERCP is difficult. EUS-AI can be a viable alternative treatment of choice before surgical treatment. Thank you very much for your time.